So POTS and long COVID are both associated with allergic symptoms. There seems to be a strong overlap, and it's not fully defined, but we know that a lot of patients with both of these conditions can develop rash, itch, hives, urticaria, which is lumps and bumps on the skin. This can also often cause quite rapid and severe palpitations and can often make it very difficult to sleep at night. And this cluster of symptoms is usually called mast cell activation syndrome, which is often described in relation to POTS and long COVID. It's not fully defined, but it's thought that there's a type of cell in your blood called the mast cell, and that's responsible for identifying things that you might be allergic to in the environment and fighting that whatever that is. But sometimes these can release their hormones and their chemicals without any obvious cause and result in these symptoms. So one of the treatments that we often suggest, if somebody comes to us complaining of these symptoms of rash, itchy skin, coming out in a red rash after, say, having something to drink or feeling stressed, then antihistamines can be recommended. And these can be either sedating or non-sedating. And they work by just stopping the release of these chemicals into the bloodstream and causing these symptoms. There are some side effects, so they can cause dry mouth, but generally they're very well tolerated. Although we would say have caution in them if you're over 60 years old, because there can be other side effects like lowering of the blood pressure, sometimes causing confusion or increasing your risk of falls. Anecdotally, we often see a lot of patients with long COVID in particular might report palpitations and quite severe symptoms at night associated with inability to sleep. And we find that giving a trial of antihistamines can rapidly and drastically improve these symptoms. And it's something to do with these mast cells releasing at night when the body is in a relaxed state. So we may well prescribe a trial of antihistamines. Again, we don't like you to be on it for a long term, but usually a trial of 1 to 2 months is sufficient.